We're looking at transcutaneous electrical nerve stimulation, popularly known as TENS. So this lesson follows the following objectives. We hope at the end of this lecture to be able to describe theoretical concepts around the use of TENS. In here, we want to know how TENS achieves pain relief. We also want to explain some of the physiological effects that follow the use of TENS. We'll identify conditions for which TENS can be used and those for which it cannot be used. And we'll look at the steps involved in the practical application of TENS in pain relief and other conditions. So by definition then, TENS is the application of pulsed rectangular wave current using skin electrodes that are applied to a patient's skin for purposes of pain relief. And typically, TENS will operate on a frequency range of 1 to 150 hertz. And as we shall see when we look at the types of TENS, the lower frequencies are regarded as low frequency TENS, and these are mostly useful for relief of chronic pain or eliciting muscle contraction. Whereas the higher side of the range, that is 80 to 150 hertz, is regarded as high TENS, which is useful for treatment of acute pain and does not produce any motor stimulation because of tetanic contraction. So we look at how TENS is able to achieve pain relief. So there are two principles or theories that try to explain how TENS achieves pain relief. So the first one is known as the pain gate theory. So in simpler terms, the pain gate theory states that if you look at this image, so you have the nociceptor there, you have the C fiber which transmits the pain, and then you have this area, so synapse at the level of the spinal cord, through which impulses pass to reach the higher centers for processing, which is the brain. So according to this theory, this gate here in red is constantly receiving sensory impulses from mechanoreceptors, thermoreceptors, and even nociceptors. But it has little preference for impulses that come through the C fibers, which is the pain signals. So as long as this gate is occupied, the pain signal is blocked from reaching the brain. So patient then will not be able to perceive that pain as long as there are other impulses that are going through the gate. So when you use TENS, the electrical impulse from TENS tends to keep this gate busy, thereby blocking the passage of the pain signals from passing through and reaching the brain. The other principle is the principle of the opioid mechanism. So opioids are painkillers, and in our bodies we have natural painkillers such as endorphins and enkephalins. So when you apply TENS, as seen in this image here, when you apply TENS, that electrical stimulation goes up to the brainstem, and through the interaction of the periaqueductal area of Gray and the rougher nucleus in the midbrain, there is stimulation of the release of endorphins and enkephalins into the substantia nervinosa, which is at the level of the spinal cord. And here, the endorphins block the release of a chemical known as substance P, which is responsible for the perception of pain. So as long as this substance is inhibited, the patient then has some relief of pain and does not feel the pain at all. So with these two mechanisms, the different types of TENS will have preferential dominance so to speak, in which theory is involved and which mechanism is involved to achieve a pain relief. Okay, when it comes to indications, when can we use TENS? So in terms of the use of TENS, then TENS can be used primarily for relief of pain, and different types of pain, as you can see here, can involve neuralgia, it can be used for myalgia, it can be used for stump pain, which is there post amputation. It can be used for chronic pain, can be used for acute pain. It can also be used for dental pain that is not odontogenic in origin. It can be used for chronic pain, period pain, obstetric pain, especially post-operative obstetric pain. And recently, research has shown that TENS has been effective in treating tremors, although this is an area of current research. In terms of contraindications, TENS should not be used on patients with heart conditions, patients with arrhythmias and pacemakers, because the electrical impulses could interfere with the operation of this equipment, especially artificial pacemakers. Undiagnosed pain should not be treated with TENS because of the likelihood of this pain to be as a result of neoplasia. So in the event that there is indeed a tumor, TENS then risks the tumor metastasizing to another area. TENS should not be used for treatment in patients with epileptic disorders, because the electrical impulses from the TENS could worsen the neural activity in patients with epilepsy. It should not be used over the eyes, over the mouth, over the spinal cord, in areas that do not have sensation. So patients should be tested for sensation before being treated with TENS. Then TENS should not be used around the abdomen, especially if you connected the electrodes opposite each other, so that the impulses go through that cavity. Because if you're using low TENS, which has the potential for muscle stimulation, that could cause problems for the fetus, as these impulses could stimulate contraction of the uterine muscles. As indicated in our first session, TENS should not be used for children or those who are mentally challenged because of difficulties in obtaining informed consent, difficulties in getting reliable feedback, and difficulties in understanding and comprehending what the treatment is about. When we look at the operation parameters that are used in TENS, we typically concern ourselves with the frequency, because the frequency then determines the type of TENS we're going to use and what kind of pain relief characteristics we're going to get from that. Closely related with the frequency is the intensity. So these two have an inverse relationship. So in low TENS, which uses a lower frequency, there is a higher intensity, which means you require a lot more electrical energy to achieve the same effect as you would in high TENS. The time for treatment depends on the condition. In acute conditions, typically treatment is from 5 to 10 minutes, whereas in chronic conditions, treatment can go on up to 30 to 40 minutes. When we look at the positioning of the electrodes for TENS, these can be put in different areas depending on the physiotherapist's assessment. You can connect them to the motor points, the trigger points, or even treat according to specific dermatomes or particular peripheral nerves that you would be treating at that particular time. This image here just shows an example of how TENS can be connected for different body areas, body segments. This is just a guide, but as a good practice in assessment and patient examination, the connection for each patient would have to be tailor-made according to their complaints and findings. When we look at the treatment parameters, it's important here to mention that there are basically two types of TENS, which are also subdivided into two groups in each category. So we have what we call high TENS, which typically uses frequencies between 80 and 150 hertz. And as indicated earlier, because of the high frequency, this type of TENS uses a lower intensity, which then results in a tingling sensation. This is quite tolerable for most patients. And then this type of TENS is useful for treating acute conditions or conditions in which the pain is very severe. And it uses the pain gate theory to achieve pain relief, as earlier discussed. So the lower TENS then will use lower frequencies. Typical range is 1 to 5 hertz, but then this range could also be extended to include up to 10 hertz in certain circumstances. And the lower the frequency, the higher the intensity, which is about 30 milliamps in this case. So this one produces, because you use a slightly higher intensity, it tends to produce a nociceptive sensation in the patient, and this is what the patient will give you as feedback. And it also results in muscle stimulation. So this type of TENS can then be used both for the sake of relief of chronic pain and also to achieve muscle stimulation. In terms of pain relief, this depends on the opioid mechanism of pain relief. So in low TENS, because of the complex nature of the opioid mechanism, patients are treated for a longer time. The advantage with the low TENS is that the pain relief is sustained. The patient gets to have longer lasting pain relief, but unfortunately that comes at a cost of time, because to achieve that kind of pain relief, patient has to be treated for a longer time. In the high TENS, the pain relief comes quickly, but is not long lasting. So the patient has to come quite frequently for treatment for them to be pain-free for considerably longer periods of time. So the burst mode and the brief intense are subtypes of the low TENS and high TENS respectively. And if you see in the table here, this simply summarizes some of the parameters you can use and the conditions or indications that could be most useful for those particular parameters, and also the patient response, how the patient feels through the skin electrodes when you use a particular type of TENS. So during treatment, we like to divide the treatment into three phases: what is known as the pre-treatment preparations, the treatment itself, and the post-treatment procedures. So in the pre-treatment preparations, we want to ensure that the patient has been prepared. Patient has been adequately assessed and examined. The patient has been checklisted to make sure they have no contraindications, and the patient has been adequately exposed for the area that is being treated. We also want to prepare the machine, ensure that the cables and electrodes are in place, that the machine is working, and we do that by testing the machine on self in the presence of the patient. After testing the machine and establishing that it is working, we connect the electrodes according to the area that we are interested in treating. And then during the treatment, we adjust the parameters. We set and adjust the parameters according to the patient's presentation and our findings. And we maintain rapport and ensure that we are with the patient throughout the treatment. After the treatment has been done, we re-examine the patient to see if they've got any new complaints, to see if their sensation has been deranged during treatment. We reassure the patient, offer them home advice, and thank them for coming. It is important that we encourage patients to be consistent with treatment, because better outcomes have been achieved when treatment is consistent and not haphazard. So what are some of the benefits of TENS as an analgesic compared to other methods of pain relief? So TENS is non-invasive. It can be done without any complications of a tissue invasion. It is better than pharmacological treatments because it does not have the usual side effects of pharmacological treatments. It can relieve both chronic and acute pain, and additionally, it could cause muscle stimulation when you use the low frequency band. It is inexpensive, it's quite portable, and it can be used by lay people even at home. It does not need expert operation for it to be effective. So as a matter of ethics then, in the use of TENS or even any other electrotherapy equipment, we have to ensure that patients get maximum benefits from the treatment that we plan to administer. For example, it is pointless to use high TENS to try and stimulate muscles because we know that is not possible. So we ensure that we use the correct treatment, correct settings, so that that treatment maximizes the benefits in the patient and minimizes harmful effects. We also have to treat patients with justice and offer autonomy. So before any treatment is done, before any exposure is done, we have to explain to the patient why. We have to do what we have to do and obtain consent from them. And above all, we ensure confidentiality in the way we manage our patients. So in terms of evidence-based practice, we want to encourage evidence-based practice where our decisions, our choices of treatment are not based on customary practice and tradition, but we do more research in areas such as electrotherapy so that the treatments that we do for patients are going to be based on current research in order to maximize outcomes in the patients. So this marks the end of the session, and be glad to join us again. We're going to have a practical as soon as we are able to do that, so we can practice some of these things. Thank you. God bless.